Moving on now to respiratory acidosis. This is when the pH is low and the pCO2 is high. So, using the equilibrium equation, if the carbon dioxide gets high, the equation moves this way in order to compensate, and this causes for the hydrogen ions to increase, resulting in an acidotic state. As for the causes of respiratory acidosis, hypoventilation is the major cause. So, for example, in patients with COPD or other lung diseases that all hypoventilate and their carbon dioxide rises, this change eventually causes the respiratory acidosis. Another cause is the use of narcotics, since the narcotics suppress the respiratory drive, causing hypoventilation. And finally, it is also found in those with muscle weakness in the respiratory system, like in diseases such as ALS, myasthenia gravis, or muscular dystrophy. As these diseases progress in these conditions, patients tend to hypoventilate and retain carbon dioxide, and that leads to respiratory acidosis. One condition worth knowing is hypercapnia, which is increased carbon dioxide. And increased levels of carbon dioxide can affect the central nervous system. Most patients with acute carbon dioxide level increase present with agitation. Some, however, have depressed consciousness, which is known as carbon dioxide narcosis. And what you need to know for clinical rotations is that any change in mental status in patients with a respiratory disease, we must consider high carbon dioxide. What we do have to do next is check the ABGs. If the carbon dioxide is too high, they usually require ventilation to bring the CO2 level down before they develop dangerous depression of the central nervous system. And this concludes our video on respiratory acidosis and alkalosis. Thank you for watching sqadia.com and keep an eye out for our next video.